What about hormone suppression or long-term contraceptive use? Can they kind of have an effect on fertility, especially in people with endometriosis?
No.
Okay.
The contraceptive pills or any hormones used for contraception does not impact future fertility.
Mm.
However, there is newer methods of hormonal suppression which you're aware of, Carla. That's things like Dynagest,
Mm-hmm.
which is a progesterone receptor drug. That is, it sort of decreases the estrogen in the body.
Mm-hmm.
So I do tell individuals, if they're on the Dynagest, which is not a contraceptive pill, to limit the use to at least 1 to 2 years. It's being prescribed now for individuals with bowel endometriosis.
Mm-hmm.
But the national guideline that we are writing together, Carla, we talk about women being on Dynagest and thereafter coming off that and immediately going into fertility treatment or fertility preservation cycles. So at the moment, there's no evidence to suggest that contraceptive pill or the Dynagest or anything would have an adverse effect on egg reserve. However, saying this, there used to be a drug that's now being less commonly used. It's Zoladex or
Oh, I was on that
Prostat.
for 3.5 years.
And the
Mm.
symptoms from that drug are horrendous.
Bad. Really, really bad.
I know. And being menopausal myself, I can relate to every symptom an individual talks about, like
Mm.
hot flushes, night sweats, headaches,
I'm
vaginal
in
dryness.
surgical menopause now, and I genuinely, compared to medical menopause through this using this medication, I had a worse time with that than I have with surgical menopause.
And thank you, Carla, for saying
Mm.
this because I do feel we individuals suffer in silence.
Mm.
And through your foundation, you've made this
Mm.
a public and more information
Mm.
for the individual. I think they could decide on what they want to do with these symptoms or even avoid these drugs
Yeah,
if possible.
I think at that time, nearly 10 years ago now, my God, that was all there was. There wasn't
You're
any of
right.
these other medications available, so we were kind of stuck with surgery or generic analogs.
Very true.
Mm.
Very, very true.